Okay, welcome everyone. I'm Rachel Reed with the Edison Awards. Thank you for joining us today for this virtual roundtable with Dr. Zeev Neuwirth. Thank you for joining us as well, Zev. Here, Edison Awards aim to recognize and celebrate innovation and innovators worldwide, ultimately promoting a positive impact on society. Named after Thomas Edison, the great American inventor, our annual awards program sets a benchmark for success in innovation and excellence in developing new products and services. Please stay tuned. This year, submissions for 2025 open in August. For today, in this session, we're going to cover the new ideas from Zeev Neuwirth's latest book, Beyond the Walls. If you hadn't yet had a chance to read it, I highly recommend checking it out, and happy to drop the link in the chat for everyone on today's call. The format of what we'll cover today, we're going to have some quick introductions and overview, and then Zev will speak to the emerging reality of the healthcare system. We will then pause. It'll be about 15 minutes. We'll then pause for a quick Q&A before diving into ways that you can make a meaningful impact in your health journey through leadership. A couple of housekeeping notes before we begin. We ask that you please stay on mute during the presentation and drop your questions in the chat. And we will ensure that these are addressed during the Q&A session. The session will be recorded, so just so you know that, if you don't want to be in the recording, please turn off your video as well to ensure that, and I suggest that you do it now. The recording will be sent to everyone on this call at the conclusion. And with that, it is my pleasure to introduce Dr. Zeev Neuwirth, the creator of an award-winning healthcare podcast entitled Creating a New Healthcare, with over 170 episodes posted to date. He has published 2 books, his first, Reframing Healthcare, a Roadmap for Creating Disruptive Change, as well as his second book, Beyond the Walls, The Megatrends, Movements, and Market Disruptors, Transforming American Healthcare. Dr. Neuwirth is an alum of Tufts University and the University of Pennsylvania School of Medicine. He received a master's in healthcare management from the Harvard School of Public Health, and he currently lectures at the Yale School of Public Health. And with that, I will kick it over to Zev. Thank you for being here.
Great. Well, good afternoon, everyone. I just want to thank you for taking the time out of your busy days to be here for the next hour or so. So this is going to be a bit unusual. It's going to be broken up. So it'll be the first 15 minutes. I'm going to really cover an overview of Beyond the Walls, and then we're going to have some Q&A facilitated. And the next 15 minutes will be a topic, some material that I've been working on, which potentially may be book 3. So I've got a request for you, and I briefly looked at some of the names of the folks who are on here, some of whom I know. There's a wide range of real expertise here on the call. And so what I'm going to ask is, as you hear some of this material, particularly in the second 15 minutes, I would really love your feedback, and either directly in the chat or directly with your comments and questions, or if you feel more comfortable, you can email me. I'm very, very used to critique. I have 2 teenagers at home, and so I don't think there's anything you can say to me that can touch my daily critique. So feel free to offer me any of your thoughts, and I really mean that. I'm very, very interested, particularly in the second half, hearing your thoughts on some of these new ideas that I've been putting together. So this presentation, again, is a really rapid overview of essentially 8 years of interviewing national and international experts in healthcare, particularly those who are really reshaping healthcare, reframing it, redesigning it, reorganizing it. The story is basically, I've been in healthcare for over 35 years, practiced internal medicine for many, many years in 3 or 4 different cities across the country, then moved into executive roles, managerial roles, and then executive roles in operations and population health. And I would say that this phrase, frustrated awe, captures my sensibility about American healthcare, my experience both as a physician and administrator, executive, patient, family member of patient. Amazingly, I mean, in awe of just all the people in healthcare. I think most of you would agree with that. The doctors, the nurses, the PAs, just, I mean, people are just, it's astounding how much brilliance and passion and professionalism and hard work and just the technology. It's just, it's an amazing, amazing set of inputs. What's frustrating is the output. And I will freely admit to you that I'm not sure that frustration actually captures the reality of it. If again, if you, and we're not going to spend much time on this, but if you look at issues of quality and safety in American healthcare, they're not getting better. Some would argue they're getting worse. You look at data from the Commonwealth Fund and the Kaiser Family Fund and others that are tracking these public health data. What you see is really, we talked about crossing the quality chasm, which came out from the Institute of Medicine in 1999. We haven't even begun to cross that chasm, and it's now nearly a quarter of a century later. I don't know if frustrated actually captures that. You look at the longevity in our country, lifespan is actually decreasing, health span is actually decreasing. You see the cost of care. As many of you may have noticed, there was CMS, just the Center for Medicare and Medicaid, just put out their Office of Actuary, just put out the projections for the next 10 years. The numbers are staggering. They're unbelievable. A Medicare patient by 2032 will be paying $25,000 a year for health care. Someone on Medicaid will be paying over $15,000 a year. The average is somewhere between $18,000 to $22,000 per American in terms of the healthcare cost. This is outrageous. It's 2 to 3 times the amount anyone else pays. And again, we're not seeing the quality or outcomes, the longevity. You look at issues like healthcare disparities, again, getting worse. I was just in Nashville. The difference in lifespan between zip codes in Nashville, one professor at the public school there mentioned the difference is now over 25 years, going on to 30 years difference in terms of how long people are living. Again, so, when people talk about a lot of lip service around social determinants of health and disparities, and I know we're trying, but really, again, frustrating. So that was my sensibility, and I've seen these numbers and tracking these numbers literally for decades. And every time there's, sort of a sense of hope or something new, it quite honestly gets dashed. So that's where we are. Again, frustrated, awe. And then about 9 or 10 years ago, I had some things happen to me which shift me from frustrated to awe to a really different dimension. I called it my Matrix moment from that movie, the science movie, science fiction movie, The Matrix with Keanu Reeves and Lawrence Fisher. I actually began to experience sort of what was behind the screen, so to speak. And it came about, and I wrote about this in Beyond the Walls. It really came about in 2 or 3 ways. One of which was my own mother was admitted to a hospital for an elective hip surgery, and essentially did not leave the hospital alive. This was an elective surgery. It's one of the most common surgeries, if not the most common surgery that's done. And the day she died in the hospital, and there were a series of errors and mishaps. And it was completely preventable. There's no question about it. She died from an infection, C. difficile, which comes about when the staff and the clinicians don't wash their hands. And it is one of the most common, what we call HACs, hospital-acquired conditions. So the day she died, though, because of the knowledge I have, I realized, and by the way, her son, her first son, who's a doctor, me, her second son is a doctor, my brother, and her third child has been working at Kaiser Permanente for over 20 years as a care redesigner and quality improvement person. So three of it out of her 4 children in healthcare, and we could not save her. That day, I knew that there were literally probably somewhere between 500 to 1,000 other families that went through the same exact experience. They lost a loved one in the healthcare system due to a completely preventable error, whether it was a misdiagnosis or an error. Those are the numbers. Those are the stats. And And a couple of other things happened. I lost a friend within a year of that. A colleague who's a physician, an amazing physician, committed suicide literally on a Friday evening after a week of seeing patients. And again, realizing that that's not unusual, that right now at this point in time, burnout and moral injury in medicine is over 50%. In fact, in primary care, 7 out of 10 doctors are burnt out and demoralized. Moral injury, the same way that soldiers in combat receive moral injury. So there's clearly something going on here. I realized it. I said, I need to do something. I need to do something different, just like Keanu Reeves in The Matrix. I swallowed the red pill and I began to look at what was behind the curtain. And the way I did this, next slide, is by reaching out to folks who were divergent. These were positive deviants. These were not people who were following the status quo. They were building things in a different way. And I began to literally just pick up, just pick up this device, my cell phone, and schedule calls with these entrepreneurs and these leaders, these divergent thinkers and doers, and ask them, what is it you're doing? How are you thinking about things? And you can go to the next slide. And at this point in time, as Rachel mentioned, I've now interviewed, I would say probably close to 500 people. And these are in-depth interviews. They're not 10 or 15 or 20-minute interviews. Many of them go on for well over an hour, some for 2 hours. We cut them down and edit them quite a bit so that when we post them, and there have been close to 180 that have been posted now, they're less than an hour, but they're typically very, very in depth. And I began to study those interviews. And if you look at the faces of a few of these folks, you'll be familiar with many of them. Steve Klasko, the ex-CEO of Thomas Jefferson, and Scott Becker, Chris Chen, Rashika Fernandez-Polle, Glenn Tillman, on and on and on. Some of them you know, some of them you don't know. They're all just incredible, incredible leaders, divergent leaders who are really accomplishing amazing things and really inflecting healthcare. And so I studied these and I recorded them. I transcribed them. I studied the transcripts. And in 2019, I published my first book, Reframing Healthcare, which was essentially their playbook, how they were reorienting, redesigning, and reorganizing healthcare. And then in just this past year in 2023, I published a second book, which was not their playbook. It was actually their strategy book. And this was the overarching strategy. And you can move to the next slide. The overarching strategy that is actually transforming American healthcare, and that is in Beyond the Walls. And yes, you can move to the next slide. Thank you. And it was really, the megatrends and movements, and really the disruptions or advancements going on in healthcare. Now, here's basically the overview. This is the upshot of the book. There are three major strategies that anyone who is interested in a positive future in healthcare. And there's a question mark there because many are concerned that we are heading in the wrong direction. I actually am a bit hopeful about this, but what I observed was they all used the same strategy. They used the digital revolution, the humanism revolution, and the business model revolution. Those were the three fundamental strategies that every single person I have interviewed has used. And what I'd like to do over the next, I would say, 8 or 9 minutes, and I'll give about 2 to 3 minutes to each one of these, is sort of discuss with you a little bit about each of these revolutions that are happening in healthcare. And I really believe they are revolutions. They're not evolutions. They're happening rapidly. Next slide. Yeah, so I'll probably come back to this later on, but what I didn't necessarily call out, although I think it's clear in the book, is that there are three things that have to happen that these strategies are driving to. If we want to really turn healthcare around in America, I think there are three things that we're driving towards. One is primary care. We could spend literally right now could spend the next hour doing nothing but talking to you about primary care. It is such a huge crisis in American healthcare. You literally, if you just go to Google and type in primary care, United States, comma, crisis, I mean, literally hundreds and hundreds of articles, and you don't have to go that far. This weekend, literally, I opened up the newspaper, the Boston Globe, the president of the Mass Medical Society, primary care and crisis. Literally, that was this weekend. There were other articles about primary care. The Mass Health Quality Partners recently put out a report about it. New Jersey has put out a report about it. There's national reports about it. We are in so much trouble. And this is so real for all of us because sooner or later we are going to need a primary care doctor, if not already, and they're just not going to be around. We have to invest in primary care. Every other developed nation spends 2 to 3 times the amount on primary care that the US spends. I can go on and on about that, but that is one major direction this strategy has to drive to. The second one is inequities, and that again is we will not solve. It's not just a moral issue; it's actually an economic issue. Deloitte has done some really elegant actuarial studies demonstrating that we literally spend billions of dollars a year. Actually, it's over $1 trillion a year because of the inequities in healthcare, and that's going to continue to grow. So it's not just a moral issue, not just an ethical issue. It is a economic imperative that we disrupt and eliminate the inequities in healthcare. And then finally, wellness and whole health. This is a really interesting topic. And again, I'll come back to this in the second 15-minute discussion. We're in a hole right now, and the hole is called chronic disease. And it is a spigot that is wide open. And literally it's an epidemic of obesity, diabetes, hypertension, on and on and on, cardiovascular disease, cancer. You can't, we will, no one can around the globe, we cannot dig ourselves out of the chronic disease management hole. There is just not, there are not enough clinicians, even with AI. I just don't think it's possible. And it's not just me saying this. It's just not possible. It's a fool's errand. The only way to solve the problem is to actually prevent chronic disease. And the only way to do that is through wellness and whole health. We need to slow down that spigot, close it down. And that is, and again, Deloitte and others have written papers about how the wellness movement is not just a foo-foo fun thing to do and a nice thing to do for a small percentage of the population. It is going to be an economic necessity, both in the US and globally. I mean, there are countries around the world literally where that 1 out of every 4 or 5 people has diabetes. You can't manage that, and that's where we're all heading, by the way. So right now in the U.S., it's about it's a little over 10% of folks who have diabetes. Again, this is an epidemic. When I was in training, it was like 1%. We need to really address these. So that is just that by the way, I did not explicitly share that in the book, but it's come out for me since then. Next slide. So let me dive into digital. And again, I'm blowing through this quickly. If you have questions, happy to answer them. I obviously discuss this in the book Beyond the Walls in much greater depth. The digital revolution is remarkable. It may be, actually, I just interviewed Robbie Pearl, who is the ex-CEO of Kaiser Permanente. He wrote a book called Chat GPT. It may be, and he makes this comment, it may be the thing that saves us. And other brilliant people in healthcare, like Robbie, like Dr. Pearl, have made similar comments. It probably is almost impossible for any one of us to really understand what is happening in the digital revolution. There are very few people I've spoken to who actually are experts in this area, who actually understand what artificial intelligence is, what it can do, how fast it's moving. By the way, AI is improving, it's doubling its capacity, its power every year. In 5 years, it will be 30 times more capable than it is today. In 10 years, it will be 1,000 times more capable than it is today. There is no technology that you and I are aware of that even come close to that rapid revolution. I don't even think the human mind can understand what that actually means. Dr. Pearl puts it this way. Imagine if your car could literally move at the speed of a rocket. That's the kind of acceleration that the digital revolution is. And bottom line, what it's doing, and it's not just AI, it's virtual, but it's that whole conversion of everything that happens in healthcare. Everything becomes a 0 or a 1. It becomes digitalized, and then it becomes computerized, and then it becomes analyzed. That's what digital means. And it's literally transforming healthcare today. What we're going to see is a transposition of time, space, and need. we're going to see healthcare move out of the hospitals. And it already is, right? With hospital at home. We have numerous companies that are delivering hospital at home, not safely, not as good as as being in the hospital, but better. If you look at the data, and there's a ton of research on this now, you're actually safer to get healthcare in your home if you need to be hospitalized than to go into a hospital. Less infections, less dementia, less delirium, actually lower mortality as well. And the cost is much, much less as well. So we're seeing the hospital at home. We're seeing chronic disease management. We're seeing primary care, urgent care move into the home. We're seeing with Cure AI and 98.62 companies that are just profound. And I've had the pleasure of interviewing the CEOs of both of those companies. You're seeing basically AI, artificial intelligence, and not necessarily generative AI, but AI and machine learning essentially doing full histories and then offering differential diagnosis and actually offering the clinician in seconds what the possible diagnoses are. I've seen a doctor actually see 3 to 4 patients at the same time using this digital revolution. It is astounding. The care is so much safer, so much more efficient. By the way, in terms of if you're thinking, well, I'm not so sure about this, do I trust the machine? Let me ask you a question because we're not dealing with a zero-sum game here. Do you know, again, how many people die from medical errors in the US every year? It's over 400,000. Medical errors, misdiagnosis, over 400,000. We're talking about an amazing amount of misdiagnosis and medical errors. And by the way, no knock on clinicians. I mean, they're doing their darn best, but the human mind has reached, it's just not capable. When medical literature literally doubles every 70 days or so, it's just impossible. And the complexity of care, whether it's just chronic disease management in the clinic, at home, or in the hospital, it doesn't matter. We need this technology. And again, it's improving so rapidly. Um, I think that's probably enough to say about digital. I'm happy to answer questions. Moving on to the business model revolution, there are 3 revolutions actually happening here. The first is around payment, and I'm just going to say, if you look at CMS, they are moving very, very intentionally, very elegantly, and very rapidly to having everyone in some sort of value-based care as opposed to fee-for-service payment model. They're serious about it. They're intent on it. You're seeing a lot of political support in Congress for it. It's just, I think it's a very, very different atmosphere. I'm not saying it's going to happen overnight, but I think we're seeing payment move. That's the first P. The second P is platforms. And if you look at let's take Amazon. Amazon is a platform. A platform is a business model. So it's different than typical businesses where basically you get raw resources, you do something with those resources, and then you sell your product or service. That's a typical business model. A platform doesn't work that way. A platform brings customers and it brings vendors together on the platform and it connects them. That's essentially what Amazon does. And we're seeing essentially the Amazonification, if you will, of healthcare. Obviously, we're seeing it because Amazon is in healthcare. You have Amazon Prime Healthcare. You have Amazon Pharmacy. You have Amazon Clinic. Most people are, again, I think a lot of folks on this call are aware of how much investment Amazon has made. They obviously purchased Medical One, or One Medical rather, and Iora Health recently, but they have PillPack. They're offering virtual care for less than $10 a month. Through their One Medical and other offerings. They've got numerous virtual companies like SteadyMD and Cure AI and Wheel through which they offer virtual care of various sorts. Just this weekend, again, just to be fair and honest about it, there was an article that was leaked, some reports where Amazon got nailed because they have a call center in Arizona, Tempe, Arizona, and there was a lot of trouble with that. They're using folks who aren't trained in healthcare. So I'm not saying that the Amazonification or the platform revolution is going to be easy or quick, but it's happening. You see it with another company called Transcarent that Glenn Toulmin founded in the last 3 or so years. And you're seeing basically on one side he has hospital systems and virtual care providers, and then the other side he has employers, and he's creating basically the direct to employer platform. It's a national platform. It's going to be really, it's already pretty impressive, and he's continuing to make it more and more impressive. So we're seeing the platform revolution, we're seeing the payment revolution, and then finally we're seeing the partnership revolution. This is astounding to me. I have never ever seen anything like it. I've never imagined anything like it. Very much like the platform revolution, but we're seeing partnerships in healthcare that are just unusual. Hospital systems partnering with venture capital firms. And again, there's a lot to be said about that. There's a lot of emotionality about that. There's a lot that's been written about that. Is that a good thing, a bad thing? The point is, it's happening. We're seeing partnerships where Hartford Health, again, is partnering with venture capital firms to really innovate in a rapid way. We're seeing the Hospital for Special Surgery, arguably the greatest musculoskeletal hospital in the world, partnering with Flair Capital, a venture capital firm, to form a virtual PT, physical therapy company called Right Move. Amazing. That is, I wrote about that in the book. It is an amazing partnership, and they hired amazing executives to really lead that. We're seeing other partnerships like Risant Health, where Kaiser Permanente formed a new company, and the first acquisition in that new company called Risant Health is Geisinger. And now these are two of the most remarkable healthcare systems in the country, if not in the world. They're value-based. They're capitated. They've come together to form a third company, and the plan is to purchase more hospital systems and more healthcare systems to join that. Not to be outdone, General Catalyst, a VC firm. I don't know that they've done this yet, but they're looking to acquire Summa Hospital in Ohio and essentially form a venture value-based hospital system. So the partnerships are absolutely it's out of control, and it's brilliant, and it's the right thing. We need really novel collaborative partnerships in healthcare, and it's happening. The last one that comes to mind, and there are many more I could run through, but Best Buy Health is now partnering with hospital systems. This is Best Buy. Yes, Best Buy is partnering with hospital systems, with pharmaceutical companies, with device manufacturers to, now they will say they don't deliver care, but they are partnering with others who do. So these retail healthcare partnerships are already well underway. Finally, the humanism revolution. This is really important. If we have the digital revolution and we have the business model revolution, without the humanism revolution, I guarantee you we are going to have the most dystopian healthcare, the most obscene healthcare system, bar none. Both digital and business have to be led by humanism. And there are literally every expert I talk to agrees with this. If we don't have this leading digital and business, we're in big trouble. By humanism, I'm talking very concretely about a number of things. The elimination of racism, of sexism, of ageism, of ableism, which is the bias against people who have disabilities, of industrialism. This is the treatment of both employees and customers as just widgets and cogs in the wheel, and classism. These isms have to be superseded and overridden and eliminated by humanism. That's what humanism means. These things can be measured, they can be compensated for, and they can be accomplished. And again, who is it? Ed Munger, the famous financier, said, show me your incentives, show me your bonus structure, show me your incentives, and I'll show you the outcomes you're going to achieve. I think we have to start to really bonus executives in healthcare, whether it be in pharmaceutical companies, device manufacturers, retail, hospital systems, insurance companies. We really have to start to bonus them on humanism. And until that happens, I do think that we are potentially heading towards a dystopian future. There are some brilliant, the thing about this is you don't have to make it up. There are such great examples of humanism in healthcare. Most of the folks I have interviewed on the podcast are great examples of what you can do and what you must do and what you should do. Um, I'll pick one just to give you an illustration. And this is amazing. The VA, the Veterans Administration, it is, I think it's the largest healthcare system in the world, and it for sure in the U.S. And they have been doing something called whole health. This has been going on for years and years. It's a huge national initiative, and it really is looking at people as whole people, looking at not just their physical issues, yes, their social determinants of health, their finances and transportation and food security, things like that. But it's also looking at who they are as people, remembering that patients are people. They're not machines. They're not just physiology. They actually have a soul. They have lives, they have relationships, they have feelings and emotions. And so the VA has constructed this absolutely brilliant whole health initiative. At the core of it are two questions. And I don't understand why everyone in the country isn't doing the same exact thing. And these are the two questions that patients are asked in this whole health initiative. The first is, it's a real shift from not asking the question, what's the matter with you? Which is, the standard question, what's wrong? Why are you here? What brings you here? What's the matter with you? They switched that to, instead of what's the matter with you, the question is, what matters to you? What's important in your life right now? Because if I don't understand the core of your meaning and purpose, if I don't understand what you need as a human being, how on earth am I going to connect with you, relate to you, convince you to do other things like take medications? So what matters to you? And then the second question is, okay, so what can we do about that right now? And those are the two fundamental questions. I think that's just a great example. Another thing they do, and I'll just mention one other thing about the VA, they have something called the Trust Index every quarter. And by the way, you can look this up. You can look up va.gov/whole health. You can literally go online, va.gov/, you will see what I'm talking about. The other thing you could look up is the Trust Index, va.gov/trust index. Every quarter, they survey 40, 50,000 veterans, and they ask them the question, how much, on a scale of 1 to 5, how much do you trust us? And there's three other questions. How easy do we make it? Did we solve your problem? And did we treat you like a human being? Those are the three questions plus the overall trust question. 4 questions every quarter. You can go online and you can see how the VA is doing on their trust index. Now, talk about trust. They literally publish it every quarter. Not only that, you want to talk about humanism? They actually break it down by race and ethnicity. Okay. Now, that is an example of humanism. And I want to know how many organizations, how many hospital systems, how many insurance companies will demonstrate that kind of humanism, asking their clients and their patients what matters to you, and then showing how much trust exists and literally putting it out there for the public to see. So it can be done, it is being done, and it must be done. We have to lead with humanism. Next slide.
So thank you so much, Zeev. We really appreciate all of those comments. We are over halfway through our hour, so I want to make sure we have time for the second half of the presentation. There's some amazing comments and commentary going on in the chat, which I'd love to bring back at the end of the presentation. We will go a little past the hour to continue this conversation. But there are 2 questions in the chat. One I think you already answered, so we'll concentrate on the other. With the magnitude of the health system today, it's just so big and so broken. How do you suggest we deal with this?
Yeah. That's a really tough question to answer in a short period of time. I will say, actually, I think the second half, the second 15-minute kind of presentation, or I won't even call it a presentation, you're going to hear me speak. I think I'm gonna try to address it in the second half. Yeah.
Perfect. Can you discuss environmental factors in the context of wellness, especially in a changing climate?
Yeah, I'm sorry, the environmental factors like
in the context of wellness, especially in a changing climate?
Yeah, I mean, the issue of I'm by no means an expert in this, but I think one of the things that's really, really encouraging is there are a lot of experts in environmental medicine and in climate change, and both clinicians and scientists and policy people and lawyers that are really sort of studying this and trying to address it. It is it's kind of interesting that I did not mention this in the book or even in this presentation, because it is and I'm grateful whoever raised that point. It's such a great point. A lot of the experts will say that climate change may be the single biggest crisis in our health and wellness. And this is both where we're beginning to already see this with the global warming. Even I believe things like the pollen count, but we're seeing respiratory illnesses and other illnesses across the country and across the globe really worsen dramatically. Folks who are, again, quite expert in this talk about how with the decrease in with droughts and other major climate catastrophes, we're going to see huge demographic shifts and people literally having to leave countries and move to other parts of the globe as a result of droughts and whatnot. And so I think it's huge. It clearly goes way beyond the scope of what we're going to be able to cover or talk about. But I do, whoever made the comment, thank you for reminding us all that this is sort of something, and it's really fascinating. As I look at the news and look at updates, it is probably one of the biggest and most frightening issues in not only U.S. healthcare but in global healthcare. And we don't hear that much about it. I'm curious if folks want to comment on this, and if someone has a sense of why isn't this more public? Why isn't this more known? I think we have to move it out of out of a political conversation really into a healthcare conversation. So thank you.
Great, thank you, Zev. I think we'll move on to the second part now. We do have about 20 minutes left in the hour, and then we'll come back to this amazing commentary that's going on in the chat and revisit some of these things and take you all off mute so that you can share your thoughts directly with Zev. Thank you
Oh,
so
that'd
much.
be great. Oh, I'm looking forward to that, to hearing from folks. So the question, and thank you for whoever again asked that question about, healthcare is so huge and so complex and so intractable, and the powers, the industrial complex is so entrenched, and there's so much profit, and on and on and on. People have talked about and written about again the greed and whatnot. The question, and it's so interesting that someone asked this question, because literally every single talk I've given since Beyond the Walls came out in September, almost every single talk, if not every single talk, someone will raise their hand and ask that same exact question. And it's usually in the form of like, but what can I do? It's just so huge. And I've had physicians ask this question. I've had leaders, I've had CEOs literally raise their hand, CEOs of multi-billion-dollar healthcare systems raise their hand and say, listen, I'm just the CEO, of a 7 or 10 or 12, billion-dollar healthcare system. What can I do to change the system? And I heard the question, and initially I thought it was a tactical or strategic question, like sort of what was asked, like, where do I start? What do I move on? And so I began to answer it from a strategic or tactical perspective. And I said, well, listen, first of all, I wrote a book, and there are dozens and dozens of examples of organizations that are actually doing something. Pick any one of those things. Pick the trust index I just talked about. Pick a whole health. Move on value-based care. I mean, there's literally dozens and dozens of things that an individual, a provider group, an insurance company, a healthcare system, whatever you want to. I mean, and I'm happy, by the way, I've offered, when this question is asked, I've offered to sit down with folks to come to their organizations and answer the question from a strategic, tactical perspective. In fact, I actually boiled the whole presentation down to 2 slides. And I said, here is what you can do. And that didn't answer the question. And after a few months, toward the end of last year, I realized that it wasn't about doing. The question was fundamentally about being. It was, what is our mindset? What is the leadership mindset? What kind of a leader? And as I began to kind of, again, this is over many, many months, I began to notice there were two types of responses. There was the, what can I do? And again, I don't want to, I don't want to belittle that response or it's an honest reaction. I have it myself, so I completely understand it. There are days or weeks when I feel it very, very strongly. But there was that response, and then there was another response, and they literally every single presentation. I'm thinking about I gave a keynote at HIMSS this year, and it was informaticists were in the audience, and one informaticist asked that question. But Zev, I'm just a informaticist, and what can I do? I'm just a physician executive. I just create the road that everyone has to travel on in healthcare. I mean, what can I do? And but at the same time, there are others who raise their hand and they start to, they were, and I'm thinking about so many of these folks who would say, Zev, I'm so excited. This resonates with me. Here's what I'm doing. And I'm not doing what, one of the things, but I'm going to take it back to my organization. I've just taken copious notes. And I saw this sort of dichotomy, and I began to sort of think to myself, wow, there's sort of this, and again, this, I'm not critiquing, this is an observation. I noticed there was sort of the status quo leadership mindset, and then there was something else. And it took me a while, and I labeled it sort of humanistic rebels. And I came to that after many, many months of sitting with groups, some large groups, some literally just, a dozen folks. And I began to notice those folks who were just buzzing, resonating, just, hugely, they had this sense of urgency. They were doing things. And if they weren't doing things, they were going to do things. And so they were led by the sense of humanism. And they were also rebels. They were not going to accept the status quo. And so then I thought to myself, well, let me go back and, I've done hundreds and hundreds of interviews. Let me go back and look at the people I interviewed. And I began to go back and study them with this thought in mind. And I realized that unintentionally, I had been interviewing humanistic rebel leaders for the last 8 years. And I began to look at like what makes someone a humanistic rebel leader. And I don't think it's a person. I don't think it's I don't think it's something you're born with. I think it's a decision, quite honestly. I think it's a choice. Do I choose to be a status quo leader and have those actions, or do I choose to be a humanistic rebel leader? And again, some of the differences, and just do we have the slide here? I think I might have. Yeah. So I began to, and by the way, we shared this in the newsletter in the last couple of months, but I began to see these differences. A status quo leader really doesn't challenge the predominant narrative, where a humanist rebel leader absolutely challenges the assumptions and beliefs. Status quo will fall back on blaming and complaining. A humanistic rebel leadership, or the mindset, is really about creating iterative solutions. Humanistic rebel leaders, oh my God, this is so, so true. They really have this sort of purpose mindset. They live in their purpose, and their focus is on improving the human condition. And they have this sort of iterative approach. They're like, well, I tried that, it failed, and I'm going to try something else. In fact, I just interviewed Sarah Baezi yesterday. She's a senior executive in the C-suite at Providence Healthcare, one of the greatest healthcare organizations in the country, if not the world, and on the West Coast, Providence. And she literally, you know, I mean, she's tried for years. She's failed. She knows what's going on. She knows the struggle, but she was an absolute humanistic rebel leader, just exhibiting every one of these tendencies and her sense of urgency. And I said to her, I asked her, Sarah, how is it that I've known you for God knows how many years, 13 years, 14 years. We did some work together early on. I said, how is it you're immune to burnout? And she just was like, she said, Zev, I'm just driven by the purpose. If I stumble, if I fall, if have a setback, it doesn't matter. I'm just going to keep on moving on. And that's, I mean, she really embodied this humanistic rebel leadership, these actions and this mindset. I think this is important. And again, I don't believe this is a personality type. I believe this is a choice that you can choose. I can choose. And in fact, I'll be very, very honest with you. I think the reason I've been doing these interviews for 8 years or 9 years, because I don't make any money at them, and doing them, they take a lot of time and a lot of effort, hours every week. I think the number one reason I'm doing them is because I want to learn how to be a humanistic rebel leader. I want some of that to rub off on me. And I would actually say to you that it has, because I've just been listening to these folks and studying them and just imbibing and ingesting that sort of attitude and that approach and those techniques that they use to keep on going. So I do think the real answer to the question, where do I start? Start with yourself. That's the answer. Start with um, really making this choice, making this decision, understanding, and this, by the way, is why I share this, because I have studied this. I've been studying this. I'm not going to go into how much I've actually studied leadership, because I study leadership intensely and have for many years, up to the very present moment. Um, but I think it's important to put this out there so people could literally have this sheet in front of them. I have another one where I actually begin to talk about the mindset, and I'm hoping down the road to actually begin to do some seminars on those mindsets. But I do think you have to start with yourself. I think it's really the question of how do I keep myself going, and I think the rest will take care of itself. Now, what's really interesting, and another question, a corollary question comes up, which is, but Zev, I'm not a leader. And people have said this to me in talks, I'm not a CEO, I'm not in the C-suite, I'm just this or I'm just that. And my answer to that is, and this came about actually, and I owe a great deal to Kristen Collins and to the Innovation Collaboratory and to the Edison folks, the Edison Award folks. I was asked to be part of a panel a few months ago at the Innovation Collaboratory. It was called the Light Bulb Series. And with me on the stage, Kristen was there as a facilitator, was the chief medical officer for Blue Zones. And then there was a researcher, a very renowned, accomplished researcher who researches mindfulness. And so these were the two other folks on the stage in this panel discussion. And Kristen had said to us months before, she said, listen, and she called me up and we had a number of conversations leading up to this panel discussion. And I'm not very proud of this, but I'll share this with you. Kristen said to me, Zev, I don't want you to talk about healthcare. I don't want you to talk about the healthcare industry. I want you to talk about health. And I pushed back and I said to Kristen, Kristen, I'm, I wrote two books about the healthcare industry. I mean, this is what I talk about. And I made the silly comment, I don't talk about health. I talk about healthcare. Silly, but not so silly. I think there's a lot of insight in that comment that would help the healthcare industry, because there's a difference between healthcare and health. And I think many people in healthcare lose sight of that fact, that healthcare is not the same thing as health. But I actually had the gall to say to Kristen, I don't talk about health, I talk about healthcare. And I pushed back and she pushed back on me and said, but you do talk about health and you can talk about health. And the truth is I do. I'm a physician. I practiced for many years. The truth is that I've studied wellness. The truth is that I've tried and attempted to launch wellness companies and wellness initiatives. So health is something that I am very, very focused on and concerned about. So finally I relented and I said to Kristen, okay, fine, I'm going to talk about health. And I'm so grateful to her. And we had a wonderful, wonderful panel discussion. And one of the things I realized as I was preparing for that panel was that everything I'd been studying, the Reframe Roadmap, the Beyond the Wall strategy, and even the humanistic rebel leadership mindset applied to health. Because if you think about it, we are all, every single one of you, every single one of us, every single human being is a leader. And the thing you lead is the most precious thing we are aware of, which is a human life. You are the leader of your human life, a human being, not a machine, a human, a mammal, and a being. And you are its leader. And that sort of came to me over and over again as I was preparing. And I thought to myself, oh my God, we can be, and we need to be humanistic rebel leaders of our own lives, our own health. One of the things that most of us don't realize, in fact, I would say the vast majority of people, whether you're a physician, a nurse, or, just whatever, most of us realize, I mean, you go to the doctor and the doctor says to you, or, whoever you go to, the clinician, or says to you, listen, Zev, you've really got to cut back on eating those sweets and that fast food. You really got to get yourself to the gym. You got to take better care of yourself. And it's said within this sort of imaginary world in which sort of this whiteboard, world. And the truth is that's not the reality. The truth is that in our culture, in our society, and this is both here and globally, the deck is stacked against us. You have these huge industrial complexes, the food industry, the alcohol industry, the firearms industry, the tobacco industry, the media industry, the social media industry, the automotive industry, the entertainment industry. You have all these industries that are incredibly sophisticated. They have incredible executives, incredible analytics and marketing, incredible sales, incredible scientists. I mean, I was talking to someone who has a friend who's a food scientist. I mean, their whole careers are spent making these processed foods irresistible to you and me. And so you have these scientists, marketers, et cetera. And by the way, behavioral change scientists, the most sophisticated behavioral change scientists are working for these various industries. And what are they all focused on doing? Their entire career, everything they know, everything they're about, their bonuses, their salaries, they're targeted at one thing, which is to get you and me to consume their products and services. Now, I'm not talking about, this is not a conspiracy theory. This is called consumerism. Okay. And, that's their job and they're really, really good at it. So in the face of all that expertise, I mean, I'm talking about experts who have postdoctoral degrees in habit formation and behavior change, and in marketing and sales and in storytelling. How are you and I? So when your doctor or someone tells you, or you tell yourself, I got to go lose weight, you're up against an army of multiple industrial. In fact, one expert called it the corporate consumerism complex, the corporate consumerism complex. A professor at City College called it this. That's what we're up against. And so you have to be a rebel leader of your own health. You have to be a humanistic rebel leader of your own health and your own life. You have to realize what you're up against, and then you have to create the micro health microcosm around that. Now, what I shared actually in the panel discussion, and I've continued to work on this new material, and I think I'll end with this, is I think there are three domains, that there are three fights, battles fronts, if you will. The first battlefront is environmental, and that's the external front. So again, the simple one, the obvious one is, what foods do you buy? Whatever you buy, in fact, I was just talking to my wife about this, whatever you buy and you put it into your pantry, you're going to eat it. Okay, sooner or later, you're going to eat it. That chocolate, I don't care where you hide it. My wife just asked me to hide a bag of M&Ms. I'm like, really? I said to her, the moment I leave the house, you're going to find those M&Ms. I guarantee you. So the question is, what are you eating? What are you imbibing? What are you watching? I don't know about you, but when I watch a movie that is frightening or tormenting, by the way, your mind doesn't know that you're watching a movie. Your emotionality, your physiology thinks it's real. So you're affected by all of that. You're affected by what you see, what you smell, what you breathe in, what you eat, what you hear. That's the environmental. The environmental is the habits you have. What habits have you created around you? Do you have it? Is it easy again? Do you have a sidewalk to walk on? Do you have the clothes where you can go out and exercise? Do you have equipment? Do you belong to a gym? That's the environmental battle. We have to set that up. That's an architecture. You can't just make it up on the second. You have to architect the battle of the environment. The second one is the domain is your relational. And so that is, again, relationship. There's so much to say about all these, but quickly, we know from research, Christakis for years ago published on network theory showing that, if your friends smoke and drink, you're going to smoke and drink. It goes out even 3 or 4 degrees. So your friends, if they smoke, chances are you're more likely to smoke. If they don't take care of themselves, so who are you hanging out with? Who are your relationships? Because who you hang out with is generally who you're going to be or become, and both good and bad. So the relationship, okay, we also know, loneliness epidemic. We know from so many different research studies that being in relationships, being in community, contributing to community, these are really helpful. So the relational front, the relational battle. And finally, I think the most challenging one is going back to humanistic rebel leadership and is the internal architecture. The easiest way I could explain this, in terms of for all of us to relate to, because I could talk about the fact that, what's our purpose in life? If someone came up to you on the street and said, Zev, what's your purpose in life? What's your life goal? What's your life mission? What's meaningful to you in life? These are really, really important questions. But I would say, the way to understand it is this. I don't know about you, but whenever I look at athletes or high performers, they all have rituals. They do meditative rituals. Listening to music. There's mantras and affirmations that they use, and I always was surprised. By whether it's performers, actors, or athletes, or executives, the really, really amazing ones, they have this sort of internal architecture, this internal environment they actually spend time on. And I just thought, oh, that's kind of cute, but it's not cute. It's real. It's the difference between winning and, coming in second, third, fifth, 10th, or last. All these high performers, technically, they're all, whether musicians, actors, athletes, they're all high performers. They all can do the job. The difference is their internal architecture, and they know that. And that's why the best coaches spend so much time helping their teammates really build up that internal architecture, that mindset. And again, thank you for the prompt. And then again, that's why I really think that this notion of when someone asks, but what can I do? The answer is to start, whether you're being the leader of your own health and your own life, your family's life, your community's life, your team, your organization, the healthcare system, it doesn't matter. You have to be a humanistic rebel leader. And you have to work on the mindsets and the actions. You have to work on the relationships that you have, and you have to work on the external environment, that architecture, and set it up ahead of time, so that it's a healthful one. I'll end with that. Thank you.
Thank you so much, Dr. Neuwirth. We really appreciate it. We are at the top of the hour, so if anyone needs to hop off, please feel free.